We are so lucky today to be joined by Scott McClintock, our Chief Strategy Officer here at Glencrest. Scott, we're doing this remotely. We're staying socially distant. We don't want to crowd the set.
Nope.
So this is our first attempt at doing a kind of a virtual call, but thank you for joining us from your office.
It is my pleasure, trust me.
Well,
let's trust him.
I think we should trust him.
We're going to trust you on that.
We did before, but that sounded very convincing.
It's so convincing. I believe it.
Scott, we wanted to talk. We got a little time with you this morning. I know you're a busy guy. You hold a lot of hats on campus. We wanted to kind of walk through some of the perspective that I know Kay and I both received, being kind of in the fire with the residents and questions that we get asked a lot. And we thought, man, there'd be no better person than to come on and just let go on questions that we keep hearing, that I know you keep hearing. So with that, you want to kick it off, Kay?
Yes, we are happy to speak to you. And I agree with Steve. We do get stopped by residents, and I think it's not that it's a miscommunication. I think they just want to be clear on a few of the protocols, because it does seem to go almost from 0 to 60, right? We were open 1 week, and the next week everything's closed. And I think some of people's questions are why, and what would you consider essential people on campus? Because I think the problem is the word essential is kind of ambiguous. Nobody really knows what that means, because essential to one person might not be to another. So tell us, from your understanding and what you read and what the governor's saying, and what would you consider essential people on our campus?
Wow, that's such a good question. Some people might say that, it's really the eye of the beholder, because we have families telling us various people in their lives are essential. So we try to maintain some flexibility in that regard. In end-of-life situations, family members have accessibility to visit their loved ones, no matter what the code level is out there. And so other essentials, of course, are clearly clinical, medical, needed treatments, things like that. But we haven't, like I said, we haven't ruled out family as well. Under most circumstances, one of the things that changed in our visitation guidelines from the governor was the addition of family members, no matter what the code in our community is. And because they realized, after about 4 months of not having any family visitation, that people were really deteriorating because of not having contact. And in our memory care units, you have a situation where if you're not in front of your loved one repeatedly and regularly, they forget about you. And so there was a real noticeable and measurable impact in our memory care units of memory care patients losing complete contact with their families and losing memory. And this is their challenge, right?
Right.
So essential people, to some extent, are defined by the residents themselves. And we try to maintain some sense of some sensitivity to the situation. So not everything is always equal, and we try to take each case one thing at a time. I will say this, in our licensed areas, we have some control. In Providence Place, it's one building, all the doors are secure. So we completely control who comes and goes from that building. And I was just over there a few minutes ago. And in our memory care and assisted living, we do have some control. But in our personal and supervisory care in assisted living, they're much like apartments, and there's not a real effective way for us to control that. So there's another example of how the families actually, on their own define who gets to come and go. What we try to do is convince people of what we're seeing in the community, of how important it is for us to pay attention. In September, our infection rate was about 600 per day, 6 to 800 per day. It's now over 7,000. Mm-hmm. So that's like 10 times the number of people in our community are being infected. Our infection rate, I just looked at it before this call, is, it depends on what measure you're looking at, but it's between 12 and 13%, somewhere in there. So more than 1 in 10 people you see at Walmart are sick. You know, you can pretty much look at it that way.
Right.
And so what we try to say is the basic protocols is wear a mask. I'm looking for mine. It's right there. Wear a mask and wear it right. You get that thing up over your nose, you know, and try not to touch it. Wash your hands. Use a sanitizer. You know, I've got my bottle here on my desk. And keep distant if you can. Avoid crowded places. And we just can't stress how important it is to really pay attention, really pay attention. Wash your hands, wash them carefully, do the alphabet when you're washing your hands. Then don't touch anything. You know, you're now a surgeon. Leave the bathroom, you know, use your elbow to get to the door, or take your paper towel with you and open the door with the paper towel and then throw that away somewhere else. So as long as you've not touched anything, your hands are sterile, and, you know, but as soon as you do touch something, you know, chances are, you know, you're not sterile anymore. So those are the things that we think about with regard to what's happening out there. I think, and Kay asked, I think her first question was, what do we see and when do we decide to close down the campus? And it's shades of gray, you know. So if you look at if you go on the Department of Health Services website and you look at the chart, you'll see from September, October, how we were near the bottom and we were only having, you know, a few hundred infections every day, and how that just gradually grew. And we kept looking at it and not seeing any infections on campus. Then all of a sudden in the last 3 weeks, we had 1, we had 2, we had 5, we had 10, like that. You know, it depends on what you're looking at. And we reopened our COVID ward in Providence Place, where we've got somewhere between 7 and 10, depending on which day you're talking about. So we do have COVID on campus, and about a week ago, we looked at each other at the executive suite and said, it's time. And I can't tell you that we reached a particular point, except that we felt like we really needed to, we felt like the infections were expanding. Mm-hmm. And so we really felt like it was time for us to really put a message out to our residents to protect themselves, to help them protect themselves by offering to deliver meals, to encourage people not to go off campus, to encourage families not to come on campus unless they need to. And that's the step we decided to take. So it was really our decision. The guidelines, however, are really provided to us through the Department of Health Services, and we don't invent the guidelines. We talk to epidemiologists, and we get good guidance on, you know, how to best protect ourselves. The good news is the vaccine is coming, and you know, we're very, very. In fact, as we speak, our long-term care residents in Providence Place are being vaccinated. This is Thursday the 7th, so I'm not sure when this will air, but on Thursday the 7th, they're being vaccinated.
Yeah, I think everything that you just said is really good in a sense of understanding that, you know, we are held to a standard that the government, local, you know, state, everybody's providing us real-time information, and you guys at the executive level are really taking all that to account, but then at the end of the day, doing what's best for Glencroft. And if that is moving the needle even further than what the local, you know, state guidelines might be, that we always are trying to err on the side of caution. Right. And I think that just from my perspective of, you know, coming through the holidays and seeing just enough people leave campus and traveling, whether it's to California or wherever, and then coming back, I think we've taken the stance and the posture of, you know, we'd rather be safe than sorry in a lot of these circumstances. And I think that how you ended that was piggybacking to my question of, you know, vaccines. Right. And obviously, we deal so much in the IL department, and that's the hotbed, that's the conversation, and everybody, including us, are trying to understand where we are with vaccines. I know that, you listen to the news and you listen to everybody that there's obviously the 1A, 1B, there's these categories. But what would your understanding of that vaccine and distribution and what the IL residents can expect, even though it could change on a day-to-day basis, but what would be your thoughts on that?
Well, we still don't have a firm date for vaccinations for our assisted living community, which those will be next, because those are people 75 and up living in a communal setting. So they will go before the independent living residents. But we expect to hear some dates real soon for assisted living. As it stands, the very first group is still underway, and that's the medical community and long-term care residents. Okay. And like I said, today is our day for our long-term care residents. So, it's hard to describe how hopeful that leaves us. As we begin to have protection for our residents and ourselves with the vaccine, we can look to a time maybe by summer where our society is back to pre-COVID kinds of lifestyles. Only thing I will say that I'm not looking forward to is the traffic to return on the freeway.
I know that we got spoiled. Yes.
I will add to this though too. The infection rates in the community remain high, and I'll give you these examples to think about. As I said earlier, Providence Place is completely controlled, and with this latest surge from October on, we have no in-house infections in Providence Place. So that's testimony to how effective that kind of infection control can be. But remember, the family members are on other side. One family member in a visitation is outside the building looking through a window. We are separating our Providence Place residents effectively from society, and that's the only way that you can do that. I will say this too, though. So as the infection rate in society is around 13%, here on campus, even with the present surge that we have in assisted living and in independent living, and including the ones that we admit to Providence Place with COVID, is just over 4%.
Right.
So we're at about 1/3 the infection rate on campus that is existing out there in society. So you should pat yourself on the back, because that doesn't happen automatically. That's through your efforts to protect yourself. It's through our efforts to help you protect yourselves. And that gives you some kind of scale to determine, is what we're doing worthwhile? And I would just have to say, yeah, it is. It really is. Because this is the vulnerable group. The elderly is the vulnerable group. And so while I'm not happy with having infections on campus, I am happy that we don't have the same infection rate that we have among the 20 to 40-year-olds out there.
Right. I know. That's surprising that is the 20 to 40-year-olds are the ones who are the highest rates right now. Yeah. And Scott, a couple questions on what you said. So when you say Providence Place, does it mean everybody who works at Providence Place is getting the vaccine now, or just the nursing staff and the residents?
Everybody.
Okay. So admin, everybody.
Yeah, including people that enter the building from our admin, like some HR people are going to be vaccinated as well, because they get over there from time to time, including myself, because I go over there from time to time. I haven't been vaccinated yet, but I've been invited.
Right.
Well, I think that's an important thing to know is, because Providence Place is such a controlled environment, but what does come and go is the staff.
Right.
And we've said that from day one that could be the age group that we're talking about of, mitigating exposure isn't really from the residents because they don't leave, but it's controlling the staff. And I think that's always been since day one of COVID. You got staff that are, we go home at night and we talk about this all the time that, we all have to make personal decisions that affect our day here at work. And because of where we work, because of who we're in the fire with, I know just conversationally have chosen to be very hunkered down and not travel and do what's right. But I think getting the vaccines in place for that staff is a critical step.
Right. Right. I mean, I was going to bring that up to you as well, Scott, because Steve and I have talked about this, because it matters that, I would say we're all here because we love the residents. And I know that goes through my mind. I'm thinking, do I want to go to this event? But it wouldn't be fair to go on a Saturday and then come in on a Monday and not feel right about that. Right. And so I feel like we're all saying the same thing. We're not just asking residents to stay home and only allow essential, people on campus. We're doing that in our own lives.
That's right. Because
it would be very counterproductive if we didn't. And I am assuming, Scott, you're doing the same thing, and it's not, nobody wants to do this. I think that's the sense, is that none of us want to be doing this, but it's the right thing to do for all the right reasons.
Well, and it comes back to, over the last week or so, we shut down the Performance Center. We shut down the pool. We've kept the walking paths available because we do know how important this is.
Exercise.
And it's the last thing we do want to do is shut down things that can help advocate health and underlying health.
Right.
But it is a necessary evil in this season that we're all guiding through. And I think my next question would be, I know that leadership and the executive team are on calls every day and meeting every day about risk management and trying to get best practices in place. A lot of the questions I get from residents is, how are decisions of closing the Performance Center, closing dining to in-person, how are those made? Is it, you're taking what's best practices outside and watching the government and what Arizona's doing and then moving the needle like we said earlier, or is it, a couple of key people in the executive team coming together like you said earlier and saying, we've got to make a hard decision right now? Right. Is it kind of all the above, or how do decisions get made? I get asked that a lot.
So we have a team that's called, we call ourselves the C team, and because most of us have a C title, but it also includes Christy Irwin, who's our administrator at Providence Place, so she represents the clinical side of these questions. Tommy Medina and Human Resources also manages our risk management, so he brings the risk management and insurance perspective to it. And then there's the rest of us, in operations essentially. And we learned an awful lot in the first outbreak in the spring, and we kind of followed the state guidelines down. And one of the things I think we learned is the infection data that we have appears always to be about 10 days late. So wherever you think you are today is where you were 2 weeks ago. And so we acted this time with a little more urgency. I think we had in independent living only a handful of infections that we knew about, maybe 5 or 6. And we just felt like there's probably 3 times that many out there. And if we don't act, if we don't separate these people, we're going to have a very serious outbreak. So based on what we learned earlier, and in following the Department of Health Services guidelines, we just decided we needed to act more precipitously, knowing that the picture might be a little bit worse than we actually knew at the time. So it's a team at the top that gets together and discusses what we do know and what we can do to protect people and making decisions accordingly. I think it's important to remember that our independent living residents are governed by the Landlord-Tenant Act. They're renters. Their apartments are their homes, and we can't dictate anything to these people. You may do as you please. So our posture is to provide you with information, such as the infection rate is 10 times what it was in September, and you really need to think twice about going out, going to crowded places. And in this case, said earlier, we are doing this ourselves. On New Year's Eve, my wife says, "We're going out to eat tonight." And I said, "No, we're not. I'm not going anywhere near a restaurant." With as many people as they're infected, in any given restaurant, there's going to be 4 or 5 people probably that have COVID. Right. And you're going to be breathing the same air. And that's what we know now, is that it's transmitted through the air more so than on surfaces.
Right.
And I've witnessed it too. I've witnessed how fast it can go.
Yes.
When it's really, there's no protection. It's just amazing, the little bug. I mean, we breathe the same air more so than we would be understand in normal circumstances. And this is the 6-foot distancing piece. So we just, based on what we've learned in the past, we took some action, and basically for the independent living residents is to help you make good decisions. If you don't have to go out, don't go out. This is why, and just this week, I sat with Mike McCammon to talk about the marketplace hours, because we have limited hours. And our question that we are trying to answer, and we still don't have an answer yet, and the team, including John Smith, who's on the board, and runs the marketplace, we're actually talking about, should we expand those hours to help people not have to go off campus, and to limit the crowds too, because with limiting the hours, it just increases the amount of people that are in there at any given time. So it's really, what we're doing is to help you. We can't stop people from coming on campus and are independent. I mean, we've got driveways all along Alice and Butler, and we can't control that. We try to limit people, but try to help them make good decisions, but we can't stop you from coming on campus. And Kay's right. The way it's going to come on campus is by people coming in from society, and that's why it's so concerning when you see the rates in the rest of Maricopa County so high, because and it's necessary. We can't, and I think I produced a document last week to help in this understanding, and it was, I think what occurred to me then and what I tried to convey is, we're part of society. We can't separate you guys. We have to have dining services people come and go. We have to have housekeepers come and go. We have to have our on-site managers come and go from campus. Your families, under the right circumstances, need to be able to come and go. You will come and go. And so there's no way to completely isolate. We have to just reduce the possible potential for infection, and that's what we're trying to encourage you guys to do. It's kind of a numbers game, but the example at Providence Place will tell you that it will work, because even with this huge outbreak we've had in society, we have no outbreak at Providence Place to date.
Yeah, that's
and
great.
I will tell you, if you do this right, because our workers coming on campus, they're the ones that have to protect the resident. That mask that our caregivers wear is to protect the residents, not to protect the caregiver.
Right.
And so if the caregiver is shedding the virus and it's in their breath, that mask can effectively catch enough of that virus to help protect the people that are around them. Mm-hmm. And testimony of not having any infections in Providence Place is evidence that can work. And that's what we're trying to get you to do. Wear that mask, wash your hands, and keep distance, and don't go into crowds if you don't have to.
Yeah.
Right, and that is another reason we are going to continue the food pantry for as long as possible, because we talk to people. I mean, I work in it every single time, and I know it has a lot of people on our campus between the marketplace and the food pantry have been able to stay on campus. It's just enough that they can, not have to leave, or if they do, it's much less. So I'm thankful that our Arizona tax credit dollars are going towards that this year.
Yeah, that's great. I think, Scott, that on a follow-up on that, and probably my last question would be, I get asked a lot, what kind of testing do I personally get done here at Glencroft? What's been the protocol for staff as a whole? I know we've been so proactive with the holiday season of right after Thanksgiving, you had to get tested twice that next week.
Right.
And our team has been very diligent about making sure we had enough tests for all staff to participate. But maybe walk us through the strategy that went around that concept of ongoing testing for staff before this vaccine actually that we all can take part in.
Sure. Well, I mean, the first go around, we had testing available for our clinical areas, for our residents, but less so for our staff. And the other challenge we had the first go around was our testing results waiting period was very long. It was days, sometimes almost a week or more before we get a result. And if you had a person who was shedding the virus who was not symptomatic, they would be infecting everybody around them, and we wouldn't get word of it until the results came back. So that's different today. What we have today is fundamentally 3 different kinds of tests that we have on campus, and they all have very quick response times. There's a blood test that looks like a diabetes test. It's a little plunger that a nurse can push on your finger, and it snaps a needle into your finger, and you can get a couple of drops of blood out of your finger. And then they use a little syringe to suck up those drops of blood and lay it out on a pad of paper, and then they put an agent on there, and then it reacts. And if it looks a certain way, it's a positive result. And that test can tell whether that test can tell whether or not you are shedding the virus, and whether or not you had the virus, like if you have antibodies. But the downside of that test, and then the results are read in 15 minutes. And the downside of that test is, however, it has a high error rate, fairly high. When I say high, it's like 20%. So it's still very, very effective. Then we have a nasal swab test where they, irritatingly, push that Q-tip, clear back to the back of your skull and dig around and pull mucus out and also dip that into an agent and then read it. And that takes like 15 minutes. That one's a little more accurate. And then we have a test that the state and the county provide us that is very accurate, but it takes 48 hours to get the results back. So what we're doing with that is after Thanksgiving, for example, we set up a place out in front of Providence Place. I think it was Monday or Tuesday, depending on what your shift was. I think we did 2 straight days in order to catch all the shifts. We tested every resident. I mean, they wouldn't let me in the back gate. I actually have a clicker that'll open that gate, and they said, no, you got to go around, you got to get a test. So we did the blood test, and if you got a negative, you were allowed to work. If you got a positive, then they took you over and gave you a nasal swab test in order to get a confirmation. And then if you got 2 positives, then it's like, okay, you need to go home because you have the COVID virus. So right away, after Thanksgiving, and we've done this also after the Christmas and New Year's holidays, we were able to test all of our employees, or nearly all of them, and we found a few positives. And so we were able to identify those positives and get them out of circulation immediately before they actually came back, before they ever entered a building. We were in the parking lot with this testing. We really felt good about that because finally we felt like we had some control over our situation, and we didn't ever have the sense anymore that we had people working that might be shedding the virus. And I mean, nothing's foolproof, but boy, that was a huge improvement over what we had in the spring.
Yeah. Good.
Oh, that's great.
Well, this has been really good, Scott. I appreciate your time. I think our residents are, they're obviously concerned, as we all are.
Right.
This is their home. This is how they do life. And like all of us, when things get pulled away from you, you get antsy as to just wanting to be heard and have questions. And I think this hopefully alleviated a lot of that. I know Kay and I get a lot of questions that we tried to bring to you today to help shed some light on. So we obviously really appreciate your time.
Thanks,
sure.
Scott.
Can I just leave you? Can I just leave the residents with this thought? If I could sum it up, it's this: there's 3 protocols. Stay away from people. 6 feet if you can. Wash your hands and wear your mask. Yeah. And the other thing I would say is, and you should take this to heart, is our infection rate on Glencroft campus, including the COVIDs we bring onto Providence Place into our isolation ward, is about 1/3 of the infection rate in society. So you should pat yourself on the back. What you're doing is working, but I'll tell you this, don't let your guard down. Because you know what it's like? I'm a boater, I'm a sailor. If there's a hole in your boat, water's coming in, period. That's all there is to it. And that's the way this virus is. If there's a hole in your protocols, if there's a hole in your protection, and you come in the vicinity of the virus, you're going to get it.
Yep.
Yeah.
And so there's just no forgiveness. And it's not that it's an evil little bug, it's just that's the way it works. And if you don't protect yourself, you're running the risk of getting that virus. But like I said, you've done well with it. Keep doing the things you need to do. And if our infection rate goes down here in the next 4 or 5 weeks, and we'll think about reopening the performance center and reopening dining, we really want to. We don't. Right. It was not an easy decision for us to close the dining rooms and close the performance center and close the pool and close activities. That's not something we want to do.
Right.
So, if you guys are continue to do good work and we have control over this, we'll reopen these things just as soon as we feel like we can.
All right.
That's great stuff.
That's good news.
We appreciate you, Scott. Thanks for all your work on this.
Thanks, guys.
All right. Take care.